In 2020, NCEPOD published a report on the quality of long-term ventilation care. Hi, my name is Mark Juniper and I am a consultant in respiratory and intensive care medicine. Fleur Perry, a user of long-term ventilation, agreed to talk to me about the report and her experiences.
I have spinal muscular atrophy. This means I have weak muscles all over my body, including those around the lungs. To help my lungs to operate to the best, we use long-term ventilation, and I've been using that since I was 16. I am a student and I do various bits of campaigning as and when needed.
Can you tell us something that you think has gone really well about your long-term ventilation?
Ventilation itself is very noticeable in how it supports my health. When the settings are right, we've got all the right equipment, we've got all the right plans in place, there is a noticeable positive impact on my health. The other thing that's really brilliant that I'd like to highlight is the amount of peer support. So I know many other long-term ventilation users, we can ask each other questions about new equipment that's been coming out or we've heard about, or different medical terms that get said in a hurry under a doctor's breath, and then an hour later you go home and go, what did that mean? And usually we're able to just check and double check each other before needing to go back and ask, sorry, what did you say?
So Fleur, that's really interesting. Where do you go for that peer support?
A few friends with similar conditions and colleagues I've worked with over the years in various disability organisations. There's also really good social media support out there, particularly in the States, but it's slowly coming over. And it's sort of a natural thing that's happened. So a friend of mine the other day messaged me and said, oh, my BiPAP went off the other night because we had a power cut. I guess I need a different machine with internal batteries. And I was able to say, okay, in the meantime, there are external batteries that might get to you quicker. And just that natural double check and knowing what to ask for is really powerful.
So is there something that you could identify where you think there's room for improvement with long-term ventilation care?
Vision around the country, around different pieces of equipment and different ways of communicating and advising with people. A lot of long-term ventilation users seem to prefer email as communicating over the phone. Sometimes the ventilation equipment can make it difficult for somebody at the other end to understand what they're saying. I've heard this is particularly the case with GPs where they're not really aware of that equipment, and so a quick email to arrange an appointment can be much more efficient than a over the phone conversation for that. Provision of cough assists is extremely patchy. This is something that needs urgent work, I would say.
You say that you started ventilation age 16 and then you've come up from children's services through to adult services. So you've been through that transition period. What worked well when you came through transition?
Having the support more locally worked really well. You know, I didn't need to be in a car for an hour and a half to get told that my equipment was fine. This is brilliant. It saves time and energy and effort on everyone's part. Also, you know, being an adult, you're treated as an equal partner in your own health management. You know, you can ask questions and be answered as an adult. You can go as in-depth or not as you would like to understand what's happening with your own health.
Was there anything that you identified in the process of going through transition that you thought could or should have been improved?
At 16, I had a chest infection. We rang the community physios who said, "Oh, we only do children. You're at college now." And we said, "Okay, where are the adult community physios?" And there weren't any. That was not helpful. I did end up in hospital when I could have been treated at home. The chest infection was took longer to recover from than it might have done otherwise. I think that adult community physios are an area that could be worked on.
Are there other ways that we could be redesigning services to improve care?
Having appointments over Zoom, particularly where their clinics are more than 2 hours away. A Zoom appointment for a smaller question is much more effective and can be organised more quickly. The person can get the advice they need in a more timely way without all the hassle associated with an extremely long journey. I've heard good reports of this. It's been happening in some areas for quite a few years, but with the pandemic, that's happening more and more now. But it genuinely does seem to save time and effort.
So, Fleur, if there was one thing that you could improve about the care that you receive at home, what would that be?
About giving people the equipment and knowledge to monitor the effectiveness of their long-term ventilation at home is a really powerful tool. So I'm talking about things like SATS monitors and peak flow meters so that people know when something has changed. Maybe their appointment is 6 months away, maybe it's 12 months away, but if they feel that something's a little bit off, and then they can check and then call in and say, "This has changed," that gives the professionals something to work with really quickly.
I don't know how much you've been admitted to hospital or experienced hospital care over the last few years, but if there was one thing that you think could be improved about hospital care, what would that be?
I haven't been admitted to hospital as a long-term ventilation unit for a respiratory issue in my entire adulthood. From talking with friends, one thing that could be improved is knowledge of the dangers of giving oxygen outside of LTV therapies in emergency situations can cause quite nasty issues. Muscular Dystrophy UK have been working with ambulance services in London to make sure that ambulance crews are alerted to use the oxygen in combination with the long-term ventilation where that would be needed for the patient. In other areas of the country, that knowledge is not well distributed.
So that's interesting, Flo. You've never been admitted since you came to adult services. So why do you think that would be?
This, I would mostly say, is down to having the knowledge to prevent and manage chest infections at home. So I have a small thermometer and a SATS monitor. If I feel that something isn't right, I can instantly do a double check. If my SATs are too low, my temperature is too high, and I have the feeling in my lungs that something isn't right, I can ring my GP, say that I need to be checked over and may need antibiotics. I can have the antibiotics within 4 hours that day. They can start working within 8 hours later, and the next couple of weeks and recovering at home. If I wasn't able to check or didn't have the knowledge or the confidence to do so, then the infection would escalate to the point where I may need more specialist assistance. So having the right equipment and the right knowledge, it's much better for us patients. We spend less time unwell. It's also cheaper for the NHS. It works for everyone. We're not in your ICUs requiring that high level specialist care because we're managing at home with the knowledge and equipment that we need to do so.
So one thing that came out in the report was that people often don't seem to truly understand what long-term ventilation really is. Is that something that you've come across in your networks?
There are so many different types of therapies and gadgets. So one of the questions that comes up a lot is, what is the difference between CPAP, BiPAP, AVAPs, oxygen therapy? And so I do think that sometimes people get a lot of information told to them, but maybe if notes were given to them as well so that it was clear and understandable and people weren't required to remember. One of the effects of ventilation being insufficient is that your memory starts to drop off a little. So expecting someone who needs a change in their ventilation to remember complex information is a little bit of an unfair expectation.
No idea whether you've got any experience of funding or commissioning issues to do with your own long-term ventilation. Is that something that you're aware of, there being things that could improve?
Absolutely. There are areas around the country where people do struggle to access long-term ventilation, particularly with the Duchenne muscular dystrophy community. There is research that shows that a person's lifespan is largely dependent on the commissioning area in which they live as to whether or not they can access the right equipment to support their breathing. I think the figures were 18 years in an area where equipment wasn't commissioned and over 30 years in an area where equipment is commissioned. That's a huge difference, and it's unnecessary.
Equipment is another thing that's clearly key to delivering effective long-term ventilation. Depends on a ventilator to start with. Is there any area of equipment provision that you think could be improved?
There is an ongoing discussion around the provision of filters for long-term ventilation, particularly BiPAP. We do understand that there is a shortage due to the pandemic, but people who've been told that they must use the machine with a filter for the last 10 years are suddenly being told to use one without. The evidence for this doesn't appear to be available, and people are feeling scared and forgotten.
So, is there one key take-home message that you think is really important as a result of this report?
There are a small number of doctors who believe that long-term ventilation does not support a patient's quality of life. That is a misconception. All of the research currently out there on patient-reported quality of life indicates that long-term ventilation does not have an impact or has a positive impact. We have a good quality of life.
Thank you for watching. The NCEPOD Balancing the Pressures report on long-term ventilation is free to access and download from our website at www.ncepod.org. ncpod.org.uk.